Good day, I'm your pharmacist. Today, I will be teaching you how to inject insulin. What is insulin? Insulin is a type of hormone that helps our body convert sugar in the food we eat into energy, therefore controlling out blood sugar levels. This is the device used to inject insulin and it's called Novopen 4. This is the insulin pen cap, cartridge holder, dose indicator window and dose actuator for insulin actuation. Now, I will demonstrate how to insert the cartridge. First of all, remove the cap of the insulin pen and twist open the cartridge holder in an anti-clockwise direction. Insert the insulin cartridge, the colored end going in first. Remember not to touch the tip of the colored end, as we do not want to contaminate it. After that, twist the cartridge holder back onto the pen until you hear a click sound. The sound indicates the holder is locked properly onto the pen. Every new cartridge contains 300 units of insulin. You can check the dose balance left in the cartridge from this window here. Every time before injecting, do check the physical appearance of the insulin and make sure that there's no changes in color or sedimentation. If there is, discard the cartridge and use a new one. Once ready to inject, invert the insulin pen 180 degrees 10 times so that the insulin is mixed well. After that, lie and roll the insulin pen in between the palms of your hand 10 times so that the insulin is close to body temperature, which will enable your body to absorb it more easily, at the same time minimizing pain during injecting. Now, fix the insulin needle on the tip of the cartridge just now. Needle of all sizes can be purchased at retail pharmacies. Remove both needle caps and discard the smaller cap. Next, we need to remove any trapped air inside the needle and cartridge. This step is called priming. To do that, pull out the actuator and dial 2 units. Hold and point the pen upwards at 90 degrees. Tap the cartridge to ensure any trapped bubbles move to the top of the cartridge. Press the actuator completely. If no insulin came out, repeat the steps just now until you see either a drop or stream of insulin coming out from the needle. Once priming has been done, pull out the actuator and dial the desired dose. Suitable sites for injection are the abdomen, upper arms and thighs. Abdomen area is usually recommended as it has the thickest fat layer, and pain would be minimal during injection. Start at 2 fingers width from the navel. Remember, do not consecutively inject at the same spot. Each consecutive injection spot needs to be at least 1 thumb's width apart from the previous spot. This is an injection guide card which can be used on the abdomen. You can inject according to the holes in the card, which are designed in such a way to promote injection site rotation. How to inject insulin. Clean your injection site. Hold the pen perpendicular, straight 90 degrees from the abdomen with the dose indicator window facing upwards and inject until the needle is fully in. Press the dose actuator completely and the number in the dose indicator window return to 0. Do not pull the pen out immediately. You need to wait for 10 seconds before removing the pen and needle. This is to ensure that all the injected insulin is absorbed properly. After injection, recap the larger needle cap and remove the entire needle from the pen. Lastly, place back the cap of the insulin pen. There's no need to remove the insulin cartridge from the pen. Every time you need to inject insulin, just repeat the insulin mixing, needle insertion and priming steps. For storage, keep the insulin pen with insulin inside at room temperature, but away from heat. do not keep it under the sun or inside your car. Insulin in use that has been properly kept at appropriate temperatures can last for up to 1 month. New unopened insulin cartridges must be kept at 2 to 8 degrees Celsius and must not be kept inside the freezer. Avoid putting the cartridges near the fridge door. If properly kept at appropriate temperature, unopened cartridges can last until their expiry dates. Remember, each needle is best used once. The proper way of discarding a used needle is to collect them in a disposable plastic bottle. This is to prevent any needle stick injury. One of the common side effects of injecting insulin is low blood sugar. Signs and symptoms of low blood sugar include dizziness, hunger, shivering, palpitations, cold sweat, and fatigue. Do inform your doctor if you experience any of these symptoms when on insulin injection. What should you do if you happen to experience an episode of low blood sugar? Consume 3 pieces of sweets or a sweet beverage. For example, 3 teaspoons of sugar mixed in a glass of water, or 250 milliliters of carton sweet drink. Recheck your blood sugar after 15 minutes. If the symptoms do not subside or your blood sugar level is still below 4 millimole per liter, repeat consumption of the sweet food or drink until symptoms subside or your blood sugar goes above 4 millimole per liter. If your blood sugar is persistently low, below 4 millimole per liter, go to the nearest clinic or hospital to seek medical attention immediately. Once you are sure the symptoms have subsided and your blood sugar is back up, you may proceed to have your meal, if your mealtime is near. Otherwise, take some complex carbohydrates such as 3 pieces of crackers of 1 slice of bread. All patients are encouraged to do self-blood glucose monitoring at home. If you have any questions, do come to the pharmacy or contact us at this number. Thank you and have a nice day.